Good morning, everyone. Our today's topic is on worm infestations. So basically, worm infestation, by this term, we mean that it means that when the worms affect the intestines and the other parts of the body. And according to WHO, it has estimated that around 1 billion, approximately 1 billion of the world's population is infested with the soil transmitted helminthes, and around approximately 200 million people are infested with the schistosomes. So basically, worm infestation means when the worms, they affect the intestines and other parts of the body. So WHO has estimated that around 1 billion of the population of the world is infested with the soil transmitted helminthes, soil transmitted infection, that is helminthes, and around 200 billion population, they are infested with the schistosomes. And worm infestation is the one of the main common problem of the children. So basically, WHO ke according, the world's population, around 1 billion population is infested with the helminthes, and around 2 billion population is infested with the schistosomes. And worm infestation is the most common and the most main problem in the children. Now, introduction. Intestinal worm infestation is a global health problem. Soil transmitted helminthes infections form the most important group of intestinal worms, affecting 2 billion people worldwide, causing considerable morbidity and suffering, though entirely preventable. Worm infestation, this is the most common problem in the children, the most main problem in the children, and it is preventable. It is entirely preventable. The incidence of worm infestation would be, it is mainly a health hazard in the developing countries. Worm infestation is the greatest health hazard in the developing countries, especially in the developing countries. It is the greatest health hazard. High prevalence of these infestations is closely related to poverty, poor environmental hygiene, walking barefoot, open defecation, and poor health services. So, the highest prevalence of worm infestation is due to poverty. Then, poor socioeconomic status, people who are living in the poverty conditions, people who are living in the poor socioeconomic status. So, high prevalence of worm infestation is closely linked to the poverty, poor socioeconomic status, improper hygienic conditions, poor environmental hygiene, then walking barefoot, nange pair walk karna, open defecation, people who are defecating in the open places, and then poor health services. So these are some of the factors which are related to the high prevalence of the worm infestation. Then intestinal helminth infestations are the most common infestations among the school age children. That we have discussed that according to WHO, it has estimated that around 1 billion of the population is infested with the helminthes. So intestinal helminthes infestation, it is the most common one, and it mainly affects the school age children. Now, predisposing factors. So predisposing factors for worm infestation would be poor sanitation, then impure water, and malnutrition during the childhood. So these are some of the predisposing factors, that is poor sanitation, impure water, and childhood malnutrition. Now, how would the child of worm infestation would clinically present, that we will discuss in the next slide. So clinical presentation of the worm infestation, that would be anemia, then malnutrition, stunted physical growth, seizures, cough, and wheezing. Mainly this is the basic clinical presentation of a child with worm infestation. So he or she will present with anemia, malnutrition, the child would be malnourished, his physical growth will be stunted, He would present with seizures or coughing, wheezing respiration. Then he would also present with recurrent gastrointestinal disorders like nausea, vomiting, then abdominal pains. The child must have abdominal pains, recurrent abdominal pain. Then the child will present with recurrent diarrhea, loose watery stools. Then he will also present with chronic indigestion, then perianal pruritus, and then pot belly. Pot belly would be protruding abdomen, large protruding abdomen. So the child would present with recurrent gastrointestinal disorders, and that would include nausea and vomiting. Then the child will present with abdominal pain. He would have severe abdominal pain that could be diffuse or in the epigastric region. Then the child will present with recurrent diarrhea, loose watery stools, chronic indigestion, then itching in the anus, perianal pruritus, then pot belly, large protruding abdomen. Abdominal pain, the child will come with this presentation. Pot belly, large protruding abdomen. So basically this was the common clinical picture of the worm infestation. That would be the child will present with anemia, malnutrition, then stunted physical growth, then recurrent GIT disorders. That would include nausea, vomiting, pain in abdomen, diarrhea, indigestion, itching in the anus, and large protruding abdomen. That is pot belly. Then he would present with seizures, coughing, and wheezing respiration. So that would be the common clinical presentation of a child with worm infestation. Now we will discuss the most common types of worms. So the first is Ascaris lumbricoids. Ascaris lumbricoids or roundworm. So the first common worm is Ascaris lumbricoids or roundworm. The common name of Ascaris lumbricoids is roundworm. So the clinical features of roundworm would be especially history of passing roundworms in the stool. The mother will complain that there is a history of passing worms in the stool. Mostly these children are usually asymptomatic. The clinical features of roundworm will be, there would be firstly a history of passing roundworms in the stool, and second, mostly the person is asymptomatic. The child is asymptomatic. He does not present with any symptoms. Only the mother will complain that there is a history of passing worms in the stool. So initially it is asymptomatic. Only the mother will complain of passing worms in the stool. That would be the history. This is the roundworm or Ascaris lumbricoids. Now, Ascaris lumbricoids, when initially it is asymptomatic and only there would be history of passing roundworms in the stool. But when it becomes symptomatic, then GIT symptoms. It will present with firstly GIT symptoms. That would be diffuse abdominal pain, especially in the epigastric region. So diffuse abdominal pain, especially in the epigastric region, and the mother will say that the child grinds teeth during sleep. So grinding of teeth, that is bruxism. Grinding of teeth is bruxism. So the child will grind teeth during the sleep time. So diffuse pain in the abdomen, diffuse abdominal pain, especially in the epigastric region, and grinding of the teeth. These are the symptoms of Ascaris lumbricoids. When it becomes symptomatic, initially it is asymptomatic, only there is a history of passing worms in the stool. But when it becomes symptomatic, it presents with diffuse pain in the abdomen, that is especially in the epigastric region. Then grinding of teeth during sleep. Then respiratory complaints will be there. These were the GIT symptoms. Then if we talk about the respiratory complaints, then the child will present with coughing, difficulty in breathing, then wheezing, respiration, mild fever may also be present, and mild hemoptysis, and that is very occasional. Hemoptysis will be very occasionally present. Sometimes hemoptysis will be present. Initial symptoms are coughing, wheezing respiration, difficulty in breathing. Then fever can also be present, and very occasionally there could be blood in the sputum. That is, hemoptysis can be present, but that is very occasional and that is very mild. Then, so these were the GIT symptoms of roundworm and the respiratory complaints of the roundworm infestation. Then complications of Ascaris lumbricoids. Intestinal obstruction. Then volvulus. Now volvulus is an obstruction. It's an obstruction due to twisting of the gastrointestinal tract. Basically, volvulus is obstruction. There will be obstruction due to twisting or knotting. Knot ban jati hai, twisting of the gastrointestinal tract, and that twisting or jo knot banti hai, that twisting or knotting, that can lead to blockage of the intestine, and that ultimately leads to blockage of the blood flow. So that twisting of the intestine or that knotting of the intestine can block the obstruction of the blood flow, and this is most commonly due to birth defect called malrotation. It's a congenital defect, that is malrotation, that occurs especially during the fetal development. So basically volvulus it's an obstruction due to twisting or knotting of the gastrointestinal tract, and it occurs, kab hota hai volvulus? It occurs when the loop of intestine, it twists around itself and finally leads to bowel obstruction. Iski symptoms wahi aayenge: abdominal distension, that is pot belly, vomiting, constipation, and stool in the bloody stools. So basically symptoms of volvulus will be vomiting, hard stool, constipation, then ultimately bloody stools, abdominal distended. So the complication of Ascaris lumbricoid would be intestinal obstruction, then volvulus, then appendicitis, then cholangitis. Now again, cholangitis is the inflammation of the bile duct system. It's an inflammation of the bile duct system, and it is often caused by the bacterial infection. Cholangitis is basically the infection of the biliary tract. Then obstructive jaundice, then acute hemorrhagic pancreatitis. So these are the complications of Ascaris lumbricoids, that is intestinal obstruction, then volvulus, and symptoms of volvulus would be bloody stools, constipation, abdominal distension, then cholangitis, then acute hemorrhagic pancreatitis, then obstructive jaundice. Again, it's a condition in which there is a blockage of the flow of the bile out of the liver. So these are the complications of Ascaris lumbricoids. So initially it was asymptomatic, and only there was a history of passing roundworm in the stool. Then when it becomes symptomatic, it presented with GIT symptoms and the respiratory symptoms. GIT symptoms were diffuse pain in the abdomen, especially in the epigastric region, and grinding of teeth during sleep. Then respiratory complaints: coughing, dyspnea, wheezing respiration, hemoptysis occasionally, and then fever. Then complications of the Ascaris lumbricoids. Now, next common worm infestation is Trichuris trichura or whipworm. The common name for Trichuris trichura is whipworm. Now, clinical features of Trichuris trichura would be: it is also initially asymptomatic. It can be asymptomatic or symptomatic. So when it is symptomatic, it may present with pain in abdomen, abdominal pain, vomiting, abdomen is distended, distension, abdominal distension, flatulence, loss of weight, and loose watery stools, diarrhea. This is the clinical picture of whipworm or Trichuris trichura. So again, it is asymptomatic initially. It may be asymptomatic, or when it is symptomatic, it presents with abdominal pain, abdomen is distended, then vomiting, diarrhea, weight loss, accumulation of gas in the abdomen, flatulence. Then in massive infantile trichoris, there may be digital clubbing. Now, initially it is asymptomatic, and when it is symptomatic, it presents with the following symptoms like abdominal pain, distended abdomen, flatulence, loss of weight, then diarrhea, then vomiting. But in massive infantile trichoris, there may be, the symptoms could be growth is retarded growth, severe anemia, then digital clubbing and hypoproteinemia. These would be present in case of massive infantile trichoris. Digital clubbing could be present, hypoproteinemia, severe anemic condition, severe anemia and growth will be retarded. Next common worm infestation is Encyclostoma duodenale or hookworm. This is a picture of Encyclostoma duodenale or the hookworm. Now, clinical features, or we can say early symptoms of hookworm would be, ground itch. Ground itch means itchy papules on the skin at the site of penetration. That we will call it ground itch. There will be itchy papules present on the skin at the site of the penetration with erythema and vesicular rashes. So these are the initial symptoms, or we can say early symptoms present in case of hookworm infestation. So ground itch, redness over the skin. Ground itch, itchy papules on the skin at the site of the penetration with erythema, redness. Erythema is redness of the skin and the mucous membrane, and vesicular rashes. Then intense pruritus, excessive itching is present. Then migration of worms through the lungs produces mild cough. So these are the initial symptoms, itchy papules on the skin which are present at the site of the penetration with excessive redness and vesicular rashes, intense itching, severe itching is present, then coughing can be present due to migration of the worm through the lung that can produce mild coughing. Then low grade fever could be present, epigastric pain in abdomen, especially in the epigastric region, or discomfort which is better by eating food. Means pain in abdomen, especially in the epigastric region, is present, or slight discomfort is present in this region, which can be ameliorated by eating food, better by eating food. Hookworm anemia due to iron deficiency. Now, anemia would be present. So symptoms of anemia will be there. That is fatigue. The patient gets easily tired. Then dyspnea, difficulty in breathing. Then perverted taste for things like mud or lime, pica. So patient has great desire for pica. Pica is any non-nutritive substance. So the initial symptoms of Encyclostoma duodenale will be, or hookworm would be, itchy papules on the skin, erythema, vesicular rashes, excessive itching is present, then coughing can be present due to migration of the worm through the lungs, then low grade fever can also occur, discomfort in the epigastric region, better by eating food, then anemia is present, then symptoms of anemia could be fatigue, difficulty in breathing, and desire for pica. So these were the early symptoms of Encyclostoma duodenale or hookworm. Then complications of hookworm infestation will be severe iron deficiency anemia. that is characterized by edema, hemic murmur, and koilonychia. Now, hemic murmur is a cardiac murmur, and especially heard in the anemic persons who have no valvular lesions. So it's a cardiac murmur which is specially heard in the anemic persons who have no valvular lesion. So severe iron deficiency anemia is present. Severe anemia is present due to deficiency of the iron. Severe iron deficiency anemia will be there, which can be characterized by edema, hemic murmur, and koilonychia. Now, koilonychia, it's a disease of the nails in which the nails become spoon-shaped. Spoon nails. We call it spoon nails, and it can be a sign of the hypochromic anemia. That is especially iron deficiency anemia. Means spoon nails or koilonychia is the most common sign of the iron deficiency anemia, in which what happens in this disease koilonychia, especially it occurs in the hand nails. So in this disease, what happens, the nail, they lost their convexity. The convexity of the nails are lost and they become flat or even concave in shape. So koilonychia is the most common sign of iron deficiency anemia, and in this disease the nails become spoon shaped. In this disease, the nails actually they lost their convexity and they become flat or even concave in shape. So severe iron deficiency anemia, which is characterized by edema, hemic murmur, and koilonychiasis. Then protein energy malnutrition, PEM, that is characterized by hypoalbuminemia. Then physical growth is stunted. So these are the complications of ankylostoma duodenale or hookworm. Severe iron deficiency anemia, hemic murmurs, koilonychia, edema, protein energy malnutrition, and stunted physical growth. So these are the complications of hookworm infestation. Next common worm is now koilonychia. Here is the picture. Spoon-shaped nails. The nails become flat or are concave in shape. They lose their convexity. Now, the next is pinworm or threadworm, that we call it Enterobius vermicularis. Enterobius vermicularis or pinworm. The common name is pinworm or threadworm. So here is a picture of pinworms, or we can call it threadworms. Scientific name is Enterobius vermicularis. Now, the clinical features of Enterobius vermicularis or pinworm or threadworm. So the clinical features would be perianal and perineal pruritus. The clinical symptoms or the clinical features of pinworm would be, the early symptoms would be perianal pruritus or perineal pruritus, itchy anus, which ranges from mild to severe. This itching could be mild, moderate, or it could be severe enough. So it ranges from mild to severe. Then severe acute pain in the abdomen. Now, abdominal pain is present in mostly all the worm infestations. So severe acute pain is present in the abdomen. The child is very restless and quite irritable. So restlessness and irritability is present. Then scratching of the perianal region may lead to excoriation and secondary infection. Severe itching is present in the perianal and perineal region, and when the person scratches, it leads to excoriation and also leads to secondary infection. Then nocturnal enuresis is present, bedwetting, loss of appetite, no desire to eat, loss of weight, but no anemia or eosinophilia is present. So the clinical features of pinworm or threadworm would be perianal pruritus, which ranges from mild to severe. And when the person scratches this region, it leads to excoriation and secondary infection. Severe pain in abdomen is present. Patient is very much restless and irritable. Bedwetting, loss of weight, no desire to eat, complete loss of appetite, but no anemia or eosinophilia is present. So these are the clinical features of pinworm or threadworm. Now, if you talk about the complications, then abacterial urethritis will be present, cystitis, vulvitis may develop, pelvic inflammatory disease may develop, and appendicitis may develop. So the complications of pinworm infestation would be abacterial urethritis, cystitis, inflammation of the bladder, vulvitis, pelvic inflammatory disease, and appendicitis. Now, the last form is tapeworm or cystodes. This is a picture of tapeworm. Now, this is a fifth variety of worm infestation, that is cystodes, or we call it commonly tapeworm. Now, the clinical picture of tapeworm is this. Now we'll talk about the clinical features or the early features of tapeworm. Clinical features: it is largely asymptomatic or may present with mild irritable bowel symptoms. Mostly it is asymptomatic. It is largely asymptomatic. There are no symptoms present. Or if present, then it presents with mild irritable bowel symptoms. Abdominal pain could be present, nausea, abdominal distension, and anorexia. Mostly it is asymptomatic, or where it is symptomatic, it presents with mild irritable bowel symptoms, pain in abdomen, nausea, anorexia, and abdominal distension. Then cysticercosis. Now cysticercosis is the infection. Basically cysticercosis is it is an infection which is caused by the larva of the parasite, call it Taenia solium. Taenia solium, or we call it pork tapeworm. Taenia solium. So cysticercosis is एक तरह का infection होता है ये. Cysticercosis is the infection which is caused by the larva of the parasite, and the name of the parasite would be Taenia solium. So cysticercosis is the infection which is caused by the larva of the parasite, that is Taenia solium. And this infection, it occurs after the person swallows the tapeworm eggs. This infection especially occurs when the person swallows the eggs of the tapeworm. So the larva, it gets into the tissues such as muscles and the brain, and finally they form cyst over there. That we call it cysticeri. Cysticeri. And when these cysts, they are found in the brain, the condition would be called as neurocysticercosis. Neurocysticercosis. So basically cysticercosis is the infection which is caused by the larva of the parasite, that is Taenia solium. And this infection occurs when the person swallows the eggs of the tapeworm. So what happens then, that this larva, it gets into the tissues like muscles or in the brain, and they finally, after going there, they form the cyst. And when this cyst is found in the brain, that condition is called as neurocysticercosis. So Taenia solium may also present as cysticercosis due to migration of the larva, which settles in the central nervous system, that is in the brain, and that condition is called as neurocysticercosis. Then epileptic attacks may occur, cognitive impairment, encephalitis may occur. Cysts may also settle in the muscle, causing lump, in the eyes, causing scotomata and impaired vision, and in the other organs also. So basically, cysticercosis is the infection which is caused by the migration of the larva of the parasite Taenia solium. So Taenia solium is present as cysticercosis due to migration of the larva, and it settles in the central nervous system. So if it settles in the brain, that condition is called as neurocysticercosis. In this, epileptic attacks may occur, cognitive impairment, encephalitis may also occur. Now when this cyst it settles in the muscles, it will cause lump. Then if it settles in the eyes, then it will lead to impaired vision or scotomata. Scotomata is partial loss of the vision, or the we can say blind spot in the normal visual field and in the other organs also. Now, these were the types of the worm infestations. Now, the clinical presentation of the worm infestation. So, now we will discuss about the clinical presentation and diagnosis of the worm infestation. So, the child will come to the clinic with the complaints of abdominal pain, vague abdominal pain, diffuse abdominal pain, then vomiting, intermittent diarrhea, no desire to eat, loss of appetite, poor appetite or no appetite, perianal pruritus, epileptic attack. Now this is a clinical presentation of the child with worm infestation. He will come with the complaints of these: vague pain, abdominal pain, intermittent diarrhea, no appetite or loss of appetite or poor appetite, perianal pruritus or epileptic attack. Now, if the child is coming with these complaints, then we will suspect this case as a case of worm infestation. Now, here are the complaints with which the child presents. Now, the physician will look and check for signs of pallor or anemia to diagnose anemia. Then signs of malnutrition to rule out malnutrition in children. Then poor growth. So the physician has to look and check for signs of pallor, signs of malnutrition, poor growth. Then if there is any cyst under the skin, then muscle mask. Then after that, physician must ask the parents also for the history of any recent epileptic attack or any previous history of the same. If the parents say yes, when the physician asks the parents for any history of recent epileptic attack, and if the answer is yes, then the patient should be sent for CT scan and check for cysticercosis, because epileptic attacks are occurring in cysticercosis. So when the physician asks the parents whether there is any history of epileptic attack, and if the parent says yes, then the child must be sent for CT scan and check for cysticercosis. Also ask parents for history of recent epileptic attack or previous history of the same. Also check for cysticercosis and then advise CT scan. Investigations would be stool test, hemoglobin for anemia, and in case of severe anemia, if hemoglobin is less than 5 gram per deciliter, so we have to check for that also. Then NIH swab test in case of anal pruritus is prominent. If anal pruritus is prominent, then this investigation is recommended, NIH swab test. And the stool examination is for positive for worms, then confirm the case of worm infestation. We can confirm the case of worm infestation if the stool examination test is positive for the worms. Now, this was the clinical presentation and diagnosis of worm infestation. Now, general and preventive management for worm infestation. Boil water and cool prior to drinking. Then maintain good food hygiene. Thoroughly wash the vegetables before eating or cooking them. Cut the nails of the children regularly. Wash hands before eating. Ask the child to wash their hands before eating. Ask the child to avoid putting fingers in the mouth. and avoid walking barefoot and always wear the footwear. So these are some of the general rules for managing the case of worm infestation. So general and preventive management. Now, homeopathic management. So basically the most common homeopathic medicines which are used are Cinna. Now, particular symptom of Cinna would be the child will have habit of constantly digging and boring at the nose, itching in the nose, then grinding of teeth during sleep, especially at the night, itching of the anus, then abdomen is bloated, hard abdomen, then twisting pain around the navel region, especially in the epigastric region, and epigastric pain is worse, especially after waking up in the morning and before taking meals. So these are the indications of Cinna: digging and boring at the nose, itching of the nose, itching of the anus, grinding of teeth at night during sleep, twisting pain around the navel, epigastric pain, worse after waking up in the morning. Then Emboliya ribes. Particular indications are itching in the rectum. Then great hunger. The child is excessively hungry soon after taking the meal. Then grinding of teeth, and child shrieks out in the sleep. So these are the particular indications of the Emboliya ribes. Child is irritable and restless, itching in the rectum. Then child shrieks out in the sleep. Then great hungry soon after taking the meals, and worms with undigested stool. Next is Ticurium. It is suited to children who have been over medicated. This medicine is specially indicated in children who have been over medicated. Then child frequently rubs his nose, frequently rubs the nose, itching in the anus, constant irritations, especially in the evening time at the bed. Then unnatural appetite. Then Centonium. It is useful for the roundworms and the threadworms, but not for the tapeworms. Now, this is a particular indication of Centonium, that this medicine is effective only for the roundworms and the threadworms, but not indicated in the tapeworms. Then itching of the nose, grinding of teeth during sleep. The child is very much restless, especially during the sleep. So Centonium is indicated when Cinna fails. When we have given Cinna in case of worm infestation, and if it does not work, when Cinna fails, then we can give Centonium. So basically this medicine is useful for roundworm and threadworm, but not for the tapeworms. There will be itching of the nose, grinding of teeth during sleep, restlessness during sleep, and coughing at night. So when Cinna fails, Centonium is indicated. Then Spigelia. The patient is very much chilly and anemic. It is very useful for the roundworms. Then excessive pain. The child refers to excessive pain, especially at the navel region. The most painful point is at the navel. Then the child vomits out the worms. The particular indication of Spigelia is vomiting of the worms. Then recurrent abdominal pain. And the child stammering, repeats the first word for at least 3 to 4 times. The child repeats first syllable 3 to 4 times. This is the most prominent indication of Spigelia, that there would be stammering. Worm infestation is associated with stammering, and the child repeats first syllable for at least 3 to 4 times. And the child is afraid of sharp pointed things like pins and needles. Then Chilone. It is specially suited for roundworm and the threadworm. Soreness of the external parts. Then Sabidilla, again chilly patient. Then tendency for respiratory complaints, itching in the anus. The child rubs the anus while sitting. In Sabidilla, itching of the anus is present and the child rubs the anus while sitting. Then Calcaria carbonica, again chilly patient, fair fat, flabby baby with large head, obstinate children, takes cold easily, excessive hunger, ravenous hunger. Then sore eructations, vomitings, sore vomiting, sore stool, and sore odor from the whole body. Cramps in the abdomen, and the stool, the color of the stool will be chalky color, gray watery stools will be present, and the child feels better when constipated, cramps in the abdomen, ravenous hunger, and the pit of the stomach is swollen like an inverted saucer. So the most common indications of Calcaria carbonica will be ravenous hunger, gray watery stools, gray green, chalky watery stools, cramps in the abdomen, child feel better when constipated, sore eructations, sore vomiting, sore stool, in fact sore odor from the body, and pit of the stomach is swollen like an inverted saucer. So these were some of the homeopathic medicines for managing the case of worm infestations. With this, we complete with the topic worm infestation. Thank you.